disease is one that is non-communicable, meaning it is not passed from person to person. It is slow, progressive in nature, and non-curable. It may be non-curable, however, with a combination of medical therapy along with counseling and other ranges of therapy. The patient can live a near normal to normal life without symptoms of the chronic disease.
So an inflammatory disease is a disease that's driven by inflammation caused by overactivity and dysregulation in the immune system. And as a result, it expresses in different ways. So diseases like psoriasis express as plaques on the skin, arthritis expresses as swollen tender joints, HS expresses as flares, nodules, and boils, and a lot of it is caused by the dysregulation and the overactivity in your immune system.
Nodule is a solid, round lesion on the skin, more than 1 centimeter in diameter. Usually they are deep and very tender. What about abscess? Abscess is the same lesion but filled with pus, with fluid, usually fluctuate, and when it drains, the pain, you notice some pain relief. And usually it's red on the skin.
The axilla is your underarm, which is probably the easiest one I've had to explain.
The sinus tract is a sophisticated channel of communication between various wounds underneath the skin. These wounds are often abscesses, such as in Hidradenitis Suppurativa. The channels allow for the open communication of things like pus and other fluids to drain between themselves, but more importantly to drain into the skin. The term fistula and sinus tract are often used interchangeably. However, it's important to remember that a sinus tract has an opening that drains into another surface, or another aspect, into the skin. Here's a diagram. This is a sinus tract. As you can see, various wounds underneath the skin. This is the skin barrier. Here is the sinus tract that is releasing pus from various abscesses into a sinus tract that's draining into the skin. These sinus tracts are abnormal tissue, which are often colonized by bacteria, and they themselves produce pus.
A tunnel. A tunnel is a tunnel-shaped lesion, starts and ends in the skin. Some people call it fistula and some call it sinus tracts, but the best terminology is tunnel.
So comorbidities are diseases that tend to happen in the same patients. They're just more likely to happen in the same patients, like HS and diabetes. Just because you have diabetes doesn't mean you're going to have HS, and just because you have HS doesn't mean that you are going to have diabetes. But there is an interesting crossover where a high proportion of patients have both. But yeah, so that's what a comorbidity is. It's just diseases that happen to, like to hang out together.